How often do you get to sit down with a doctor that specializes in helping women with their periods and get tons of tips for regulating hormones, holistic solutions for pain-free periods, and much-needed education on your cycle? Not very often, am I right? Well, that's what we are going to do right now in this amazing episode. Dr. Saru Bala is a naturopathic doctor on a mission to educate women of all ages so that they can understand their bodies inside and out and have confidence in their health. Sign me up. Maybe you've always had period struggles, or maybe they popped up later in life. Maybe you just need tips to share with your daughter or a friend. Wherever you're at, this episode is going to help you so much, giving you the knowledge you need to take a step toward comfortable, easy menstrual cycles. I appreciate you spending some of your time with us on the show today. If you've gotten any benefit from the Daily Wellness Podcast, would you take 1 minute to leave us a stellar rating and review? You can find the links to do so in the show notes. Thanks so much. Welcome to the Daily Wellness Podcast. I'm your host, Melissa Meredith. I've led my family on a transformative health journey for over a decade, and now I help other families do the same. This is a place where busy moms can learn about healthy living. I hope that what you learn here helps you feel empowered to take the next step in your family's health journey. Saru, thanks for joining the Daily Wellness Podcast.
Yeah, absolutely. Thanks for having me.
Yeah, I am so excited to chat with you and learn from you because I've already been learning from you on social media, really. A little bit. And so I want to pick your brain some more. It just seems like you have a wealth of knowledge about all things women's hormones related and, our cycles and all of those things. And so I have lots of questions for you today, but can you just kind of share what brought you to do what you're doing today and kind of what made you so passionate about this?
Yeah, I mean, obviously, I feel like what woman do you know that hasn't had her own period struggles, hormonal health issues? Like, that's pretty much all of us at this point. So just having my own issues with really bad pain and bleeding and PMS. And then while I was in med school, we learned so many different tools and strategies for this that nobody else was talking about. Nobody else is, I would go to the doctors, and the only option I was ever given, especially in my, early 20s, was birth control. And I was like, well, birth control did not work for me. I hated how I felt on it. It made me feel miserable. I just didn't want to have to remember to take a pill at the same time every day. Like, it was just a lot. And I was like, I don't want to have to do that. And they're like, well, and so I was like,
yeah,
I wanted other women who felt the same way to have opportunities for being able to address their PMS, address their pain, address their bleeding without needing to be on birth control if they didn't want to be on birth control or whatever it might have been.
Yeah. I think one problem that people have in this area is just thinking that what they're going through is normal, and not knowing that it can actually be better than where they're at right now. Yeah. So can you kind of just talk to us about when it comes to PMS symptoms and period struggles, what things are normal and what things should people get help with?
Yeah, that's a great question. I will say, I think a lot of us are conditioned by society, by our families, by our moms to think that struggling with periods that are really heavy or painful or being irritable and moody and tired all the time is just a part of having a period. And it's not at all. We can have a period that we don't realize is coming because we don't have pain or mood symptoms or, fatigue or headaches or breast, none of it has to be a part of your cycle. So I've worked with a lot of women where they don't have any symptoms. They reach out to me and they're like, I literally didn't know my period was coming. I remember I had one woman who sent me this email, and it was this really long email, and I was like, oh no, what is this? And she goes, because the subject was, Dr. Bala, you made me stain my underwear. And that was the subject line. And she basically went on to say, I've never had a period that I didn't know was coming. I finally had a period where I had no idea, and I bled through my underwear and didn't realize I was on my period. So
that is so funny.
It was hilarious. I was like, that was a great way to capture my attention.
Yeah.
So yeah, it is very possible that you can have a period that you don't feel miserable before, during, or after in.
Yeah. So you shouldn't be every, time you start your cycle, you shouldn't be having to lay in bed, skip work, take pain pills.
No. And I just, we're all, on a different journey. We all have different things going on. There are some conditions where there's only so much that we can do, and you still do deal with some level of pain or discomfort or, fatigue, whatever it might be. I'm not saying that every single woman on this planet is going to have completely painless, completely symptom-free life and periods, but it is possible if you have really bad ones to minimize that, to get it down, to not struggle in your daily life, to not be anxious about your periods coming, to not feel like this doom of, oh, my period's coming.
Yeah. And I mean, most of the women I know, I would say, have at least some mild pain with their period. Like I can't think of a single woman actually that has like no symptoms. I'm sure they're out there, but
right. Yeah.
I would say the majority of us have at least something, that we're struggling with related to our period. So why do you think that is? Why are so many women struggling?
I mean, like, look at our life, right? We're all very stressed out. We're not sleeping well. Food system and the quality of our food kind of suck. We don't spend a lot of time outside. We're just going all the time. We don't stop to eat. We don't stop to breathe. We don't move our bodies as well as we should. Not, winding down. We're not always having 3 meals. Like, when we do these things and we can slow down a little bit, I had a colleague of mine who also is a women's health doctor, and she said, my acronym for PMS is please move slower. It's your body literally telling you to slow down. And
that's good.
Yeah. I love that she said that. It was Dr. Leah Gordon. She mentioned that, and I was like, that's great. I love it. So that's essentially what our body is telling us, right? Our nervous system needs a little bit of support. Our blood sugar needs support, our liver and our gut, like all of these things around us that we're doing on a daily basis. We have to really kind of look at our life and say, well, are the habits that I do on an everyday basis supporting me to have healthy hormones? Maybe not. And where can we make some small changes here and there to help facilitate that?
Yeah, that's so good. I agree. I think there's a lot of different factors like at play, and food for sure, environment for sure, chemicals in our personal care and home products, like all the things. Yeah. What do you think about like the status level of education that women are receiving about their hormones and about their period? So, I mean, about women's health education or the lack thereof, how does that play into kind of some of these struggles that women are facing, do you think?
Right. I mean, we really don't get any education. I remember my sex ed was in like middle school. We watched a video from like the 70s that showed us how to use a tampon, and that was about it, right? Like, we really did not get any sex education. We didn't get any period education. We didn't get any body education, nothing to really tell us, here's what a period even is. Here's why it happens. Here's what it means. Here's the different phases of your period. Here's what you might experience. Here's what you can do. Like that, we didn't get anything. Nobody gets anything. And then you go to your doctor when you're, in your teens and your 20s and your 30s, and you're like, I feel miserable. And they're like, well, take birth control. If you don't want birth control, take, pain meds or take an antidepressant. Like, there's really no education there. And it's not always their fault, right? Some of them just don't have other tools in their tool belt. Some of them don't have the time to educate you. Like, how many of us really have more than 5 to 10 minutes in an entire doctor's visit where we're
true
here. So there's a lot of different stuff going on. So I think, women's health education plays a huge role because most of us just have no idea how our bodies work. We have no idea, how birth control is working in our body. We have no idea, are we ovulating? Are we not ovulating? When am I ovulating? How long is my luteal phase? What are my estrogen and progesterone levels doing? Like, what can I do to support myself? I didn't even know that my gut and my liver were connected to my hormones. I didn't even know that my stress is the reason that my PMS and PMDD are so bad. Like, there's so many connections that I get, messages all the time from people being like, I had no idea these things were related. And I, made this one change and all the difference for my period. So I think just being able to educate women and have them understand what's going on in their body, have them be more connected. How many of us, like, I also get a lot of comments and messages from women being like, I just want to be on birth control so I never have a period. I never want to think about it. And it's like, when we're not connected to our bodies, we're not going to know what's going on in it. And the more connected we can be, the more progress and the better we can feel in our body. Because the more you try to remove yourself from your body, the worse you're going to feel.
Yeah. I'm pretty sure my education about well, the very little that I got, I wouldn't even really call it an education, but anything that I learned, I'm pretty sure it was like from Teen Magazine.
Yeah, Cosmo. Yep, exactly. Looking at from Cosmo for sure. Eat pineapples, it'll help your vaginal health. I feel like that's the extent of information you got growing up.
Right, what to do about my acne and
Yeah, exactly.
that's so funny. Yeah. Well, I'm glad I'm not the only one because I swear I didn't really even know there were like 4 phases of my cycle until I was like in my late 30s. So,
And I think that's most people. Like, had I not gone to med school, I wouldn't have realized that what was even going on with my hormones. So,
yeah. Okay. Well, that makes me feel a little bit better that I wasn't the only one, but I hope it also encourages the women listening to actually learn. And I know it has motivated me to like teach my daughters, because I got to where I was learning things and I was like, why did nobody tell me this? Like, I've got to tell my daughters so that they are like on top of it and know these things and know like the interconnectedness like you talk about. That's huge.
right. I totally agree.
Yeah. So before we talk about solutions, because I do want to talk about some specific things and how you would address it, but would you say that kind of how you approach like helping women is different according to how old they are? Like, is a journey for a teenager struggling with her hormones going to be that much different from a woman in her 30s or 40s?
Not always. It really just depends on the situation. It depends on the symptoms. It depends,
Okay.
Other health factors or lifestyle. I'm not, I might be a little bit more conservative with the recommendations I give to a teenager because it's really hard to tell a 16-year-old, hey, go to bed at 9 p.m. and wake up at 6 a.m. They're going to roll their eyes and be like, okay, see ya. So, we'll kind of tailor it to the person that I'm working with. I mean, I have a lot of older adults who are also like, see you later. I'm not going to bed at 9 o'clock. So you kind of have to tailor it to the person. And it really just depends on, what's going on, what they're dealing with, what their symptoms are, what their lifestyle looks like. Are you a night shift worker? What are you, how have you been on birth control for 20 years or 2 months? Like, what is, are your symptoms new? Are they, really severe? Or are they just mild? And you're like, I want to, take it. There's so many different spectrums. So the healing journey is very like tailored to each individual and where they're at and what they're needing and how their body is receiving, giving it.
Yeah, that makes sense. You kind of already mentioned, but just to clarify, so if I was to go to a conventional doctor, number one, they wouldn't really have the time to really sit with me and educate me, kind of, and give me some guidance on lifestyle changes and things like that if they knew it. And then secondly, we kind of talked about how really their only solutions are like birth control, pain pills, things like that. So let's talk about what some other solutions might be, right? So what is your approach like when a woman comes to you with period struggles? Like, let's say, what if she's just having pain with her periods? Like, how would you go about helping her?
So it really just depends on, again, like what's the chronicity? When is the pain happening? I have some women who have endometriosis and they have pain for their entire cycle. And then I have people who just have pain for the few hours of their first day or whenever the bleeding is the heaviest or just when they're bleeding for the entire time. That like there's so many different levels of pain. There's also so many different things that might be going on, right? Is there endometriosis? How chronic is that? What stage is it? Like, where are you at in your lifestyle management of that? Are you completely new to this world? Have you been trying other stuff? Have you made certain lifestyle changes? So there's a lot of different factors that we can consider.
Yeah.
Like, is it your liver needing support? Do you also have symptoms of, waking up in the middle of the night, having hair loss, having acne, not being able to digest your food, feeling bloated, uncomfortable, not pooping, the other skin stuff? Like, there's so many other symptoms that can accompany the pain. It really just depends on where they're at and what other symptoms they have in what we're going to address. So is that going to be more liver focused? Is that going to be more gut health focused? Is it going to be your cortisol regulation? Like, what's going on in your sleep and your morning routine and your bedtime routine and your stress levels? And how are you handling your overall nervous system? Like, how is it handling the stress in your life? So all of these are going to be a factor that we work on, right? Like, I talk about your bedtime routine. I like to talk about your morning routine. We'll make these changes together. And then what supplements are you currently taking? Do we need to cut out a lot of these things? Because I get a lot of people who come to me with a very long like laundry list of stuff. And then, what can we add in that's actually going to support you, right? Do you need some electrolytes? Do you need more hydration? Do you need some fiber? Do you need more protein? Do you need B vitamins? Do you need antioxidants? Like, where is it that you're needing the support? Because all of those are things that I've used for period pain, raspberry leaf tea, magnesium, like all of these are options we can do. I don't want you to do all of them. I just kind of want to see what's going to be the most effective.
Yeah. And do you recommend or do any testing with your clients, or is it mostly based off symptoms?
With pain, it'll mostly be based off of symptoms. There's not a ton of labs you can do. I always like to do testing for everyone that comes through just to get a baseline for blood work, like what's going on with your hormones. How are you making enough estrogen and progesterone? Just the basic stuff. Where's your thyroid? What's going on with vitamin D levels? How's your immune function? What's happening with, do you have any anemia? Like all of, I just want to do my due diligence and make sure there's not another factor as to why you might be having more pain than you need to. And then on top of that, all of those other things that I mentioned, adding in supplements, working on lifestyle stuff.
Mm-hmm. That's awesome. What would you say some of the main problems that people have that come to you? I mean, the pain,
PML, PMD, like the mood stuff, and then heavy bleeding. Those are the three main things that I deal with.
Yeah. Okay. And so lifestyle factors, is that something that you kind of like give them guidance on as far as diet and stuff? Like, are there things that are good to eat or not good to eat for your hormones?
Right. Essentially, I don't necessarily push like certain foods or certain specific like diet plans. I'm very much like, I want you to be able to eat what you enjoy eating. And as long as it's mostly whole foods, I'm happy with it. So that's kind of what I focus on is, eat your fruits, eat your vegetables, eat your legumes, eat your proteins. Like I'm not necessarily going to say cut out this entire group of foods, cut out, eat this certain way. If you already do, that's fine. We can work with that. But I'm a big proponent of enjoy your life, eat what you enjoy eating, and let's make sure it's whole foods as much as possible.
Yeah. Since we've talked about birth control a little bit, what do you feel like are some of the problems with just putting a woman on birth control for period problems?
Yeah. So this is such a controversial topic. I feel like a lot of women are so split on birth control. There's some people that are like, absolutely, birth control is the worst thing that ever happened. And then there's so many women who are like, birth control works for me. Like, I like it. And so I'm very much a proponent of do what works for you. Just be informed, right? My biggest issue with birth control is not the birth control itself. It's that is the only option most women are given. And they're not told exactly what it's doing in their body, right? A lot of women are like, I'm on birth control to fix my hormones. It's not necessarily fixing your hormones. It is covering up the entire process that's going on in your body. So yeah, you don't have symptoms because you're not having a period anymore. You don't have the symptoms that were associated with when you were cycling because you're not cycling anymore. So that's how it's working. And if that's fine with you and that's what you want and you don't care, and then that's great, like do what works for you. It is your choice. It is your body. I'm never going to shame somebody about birth control. And it doesn't need to be the knee-jerk, reflex of you have period issues, here's birth control. Because there are other things that we can do. There are so many lifestyle considerations that we have to take into account before we just say, take birth control. Because pretty much every woman I've worked with has seen some level of improvement with their health without needing to be on birth control when we address these basic foundational things. So I like to make the distinction of awareness, understanding, know what you're doing, know why you're doing it, know how it's working in your body. And if that's what you choose to do, then that's your choice.
Yeah, that's my biggest issue too. I think that every woman should be informed. And I think that they're not, like on some of the risks that birth control, has and what birth control is really doing. Like gets given to them as a solution without them really understanding what's going on in their bodies with the birth control.
Right. And I will say I've had a lot of women that I worked with who they came to me, they didn't want to be on birth control. They tried birth control, didn't like it. They just didn't want to be on it. And that ended up being the best case scenario for them. They're like, I tried the other stuff. I did the other things. I'm not getting the resolution that I want. I think birth control is where I want to opt into being, which is, that was the decision they came to. And we worked on getting those symptoms while they were on birth control from the first time they tried it and were having a miserable time to they were able to be on birth control and not have all those miserable symptoms. So there's a spectrum of people, and I can't just say this is going to work for everybody because everyone's body is different. So The awareness is just very important. I think that's my biggest issue that I get so passionate about is it's not regulating your hormones. And I just want people to understand that that's not how it's working.
Yeah.
Choose that. That's your choice.
Yeah, same. Yeah. So I know with some birth controls, like you can be not menstruating then, right? And some women just have that's their period problem. Like they're not getting their monthly cycle like on a regular basis. It's not coming, maybe it's coming every 12 weeks or whatnot. And so I've heard that when you're not menstruating, like that can cause some problems in your body. For one, like that's kind of a way that we detox as women. I've heard that there's like actually, toxins in our menstruating blood that our body is kind of getting rid of every month. So I don't know. What are your thoughts on that? Like, is it healthy or not healthy to cut out the menstruation?
The reason that we have a period is because we are shedding the lining that gets built up, right? And so when you're on the pill, essentially what we're doing is stopping ovulation. And so you're having a withdrawal bleed from the level of estrogen that was in the pill. And so if you're not on the pill and you're not having a period, that is something that we need to look into because what's going on, right? There's something that's affecting you from not ovulating. And we want to see, is there a thyroid issue going on? Do you have something like PCOS? Is there some chronic inflammation going on from some, EBV, mold, infection, something going on in your body that we want to address, right? Because your period is a vital sign, just like we check your heart rate, just like we check your blood pressure, just like we check your temperature. We get to see your ovulation and your period to get a better idea of what might be happening with your body. And so that's really what I like to tell people is that's why I like you to track your periods and know your periods. And it is a natural process that your body is doing. I feel like the topic of whether or not you need to be like cleaning it out, like that's the thing where I think people are like, oh, well, I'm not on birth control and I haven't had a period in X months and my doctor wants me to take progesterone to evoke a period so that I can shed the lining. If you're not on birth control and you haven't had a period, your estrogen levels are probably not reaching a level that is high enough to have too thick of an endometrial lining, because that's always the concern with cancers and that kind of stuff. And I chatted about this with another OB where she specifically worked with PCOS patients who, a lot of them are not ovulating. They go months without a period. They have really irregular bleeding. And she was like, I'm not seeing a significant endometrial lining in these women. So it's not really that huge concern of, they're not bleeding, we got to get them to bleed, because their estrogen levels aren't high enough to get to that point in the period.
So would working on their estrogen levels then be the thing for those women?
Why they're not ovulating and why they're low in the first place, right? So especially PCOS, there's a huge factor with blood sugar, with insulin, with testosterone levels, all androgens in general. So we really have to get into, okay, well, why aren't you ovulating? How can we get you to ovulate? How can we get those cycles back on track?
Yeah. Since you mentioned PCOS, that kind of made me think of another question, which was like with PCOS and endometriosis, I feel like a lot of women are just given that diagnosis and told they kind of have to manage that for the rest of their life. Has that been true in your experience with your clients?
I don't work as much with the PCOS population, but with endometriosis, I mean, I will say as far as PCOS, like when you have it, yes, you do have it. And it is something that you will have to manage and keep at bay. That's not to say you can't get pregnant. That's not to say that you can't have regular periods, that you can't maintain your overall health. You might just have to try a little bit harder than the average person who doesn't have PCOS. So it is
that's really good.
Periods. It is possible to, ovulate and get pregnant and just live your life normally. But again, you might have to try just a little bit harder than the average person. Endometriosis, a lot of women I've worked with have opted to do the surgery itself because we got their pain down to, from being every single day of their cycle to just a few hours or just a day or two of their cycle. And they're still like, you know what, this is so, like, I know I have it. I just want to remove it if it's possible. And they end up feeling better. And then a lot of the things that we do together is also preventing it from coming back. Because the biggest thing with the surgery is that a lot of people will get the surgery and then 3 years from the surgery, they're like, well, it came back. And
I've heard that.
Yeah. And so that's where a lot of people are like, well, is it even worth it? It is worth it if we can get you to a point where it's not coming back. We're keeping it at bay. Like, you did the surgery, you got, as much as you could out, and we're making sure that it doesn't get back to that point.
Okay. So there are things that you can do to kind of preventatively maintain that healthy state.
Yes. Yes.
Yeah, that's really good to know, because I hope that a lot of women also get hope from that listening to this episode, because I know that's a really frustrating place.
It is, especially endometriosis. Just getting the diagnosis in general is hard. But I will say, like, there are some women that I've worked with who have really severe endometriosis that, one, is not able to be surgically removed because of where it is and how it's, grown, or just it's so severe that they weren't able to remove all of it. So, there are specific cases, but I would say for a good chunk of the women that I worked with, we are seeing, resolution, progress, changes in that, and the prevention of, if they get the surgery, from it coming back.
Mm-hmm. Yeah. What's the connection between gut health and hormone health?
So there's so many different connections, right? We've got the gut-brain axis. We've got our a majority of our immune system lives in our gut, and your immune system is what is regulating in your inflammatory response. It's what's regulating pain. And so there's a lot going on as far as there's a lot of connection between endometriosis and gut health in general, especially with like gluten sensitivity and that kind of stuff too. So celiac disease and endometriosis and thyroid issues and like there's so many different connections between all of that. So a lot, pretty much, I can't give you necessarily a number, but most of the women who I work with who have endometriosis, we are working on their gut. And that is where a lot of symptom resolution happens, is when
you say working on their gut, what does that look like?
Depends on their symptoms, right?
Yeah.
Dysbiosis, which a lot of them do, meaning there's just an imbalance of that microbiome. There's either low commensal bacteria or an overgrowth of maybe fungus or parasites or bacteria or viruses or whatever it might be. And we need to help bring that down and bring up the commensal bacteria. So just bringing that balance. That can look like using antimicrobials or binders or biofilm disruptors. It can look like, even for some people who have SIBO, will use antibiotics or antifungals. Like, I'm not opposed to using the conventional treatments when we need to, and then integrating it with natural therapies when we can.
Yeah. And how do you know what the issue is? Is it by symptoms or by test that you kind of know what's going on there?
Both, yeah. So a lot of the symptoms of dysbiosis are going to be like really severe gas, really severe bloat, really foul-smelling stools, constipation, chronic constipation, or urgency, frequency, diarrhea, floating stools, or like waking up in the morning and having gas, or just constant distension, lots of skin stuff, brain fog, hair loss, systemic stuff like psoriasis, eczema, rashes, hives.
Oh my goodness.
White pain that's unexplained, autoimmune disorders, right? Like, there's so many symptoms that can be associated with gut issues. So just kind of depending on where they're at. But the main like GI symptoms that you'll see are going to be like the gas, the bloating, the urgency, that kind of loose stools, chronic constipation, those kind of GI symptoms that are just, no matter what you do, always there.
Yeah. Well, one thing I told my daughter that would help her gut health is to kind of eat less inflammatory foods and try to make sure she's getting enough probiotics, either from foods or from a supplement. If she's not, on a day where she can eat probiotic foods, would that be a good recommendation for a starting place?
Yeah, absolutely. I mean, probiotics can absolutely be very helpful. And I think a lot of us aren't eating enough fermented foods in general. So adding that on a daily basis can be, I think that's a great maintenance. If you have dysbiosis, it's probably not going to be very helpful to just add probiotics from your food, or even just probiotics as a supplement. But as a maintenance, eating, probiotic rich foods is going to be great for your vaginal and your gut microbiome.
Yeah. Good. So for someone that's just starting, or for us moms that want to have a pep talk for our daughters, what would you say is kind of like the starter kit for healthy, painless periods?
Okay. For like a younger girl, I would definitely say, if you have periods that are painful, start with raspberry leaf tea. I think that's the easiest one that, a younger person can do when they want to completely change how they're living and going out with their friends and eating out and all of that stuff. Start with raspberry leaf tea, getting it, your fiber with each meal and getting in your protein with each meal. If you can get those two things, eat breakfast, those kind of foundational pieces, try to get, adequate amounts of sleep and movement, the basic stuff that we tell everyone, which is also very important to have those foundational habits as a kid, because what we do when we're, younger is honestly what we continue to do in our older age. And it's much easier to create those habits younger than it is to change it when we're late in our 30s. Yeah. So eating protein with each meal, getting fiber with each meal, focusing on raspberry leaf tea, multi-magnesium. Like I go too hard on supplements for somebody that's young.
Yeah, that's good. I think everything you just listed, maybe other than the raspberry leaf tea, that's a little specific, but those, I mean, in general, those are great like lifestyle modifications that we should really all be making for our overall health anyway.
Exactly. Yes.
Yeah, that's awesome. What results have you seen in some of the women that you've worked with that came through your practice? Can you give us a couple of examples of women that you've helped?
Yeah. Oh my God. Well, give me one condition, because we've done a lot.
Yeah, we have. What's something we haven't really talked about yet? I mean, maybe a woman that is bleeding too much. We haven't talked about that.
You were literally reading my mind. I was just thinking of someone who her main issue was endometriosis and heavy bleeding. So
yeah,
we worked together for a few months, and she came with severe pain to the point of throwing up and like nausea.
Oh, that's awful.
Horrible. She couldn't leave her house for the first 5 days because she would bleed through every hour, like bleed through her clothes. And she's like, I'm literally just stuck inside my house like for a week every month. And we worked on her gut. Her gut was a huge factor too. She had a lot of bloating, a lot of gas. So we worked on the dysbiosis with some antimicrobials and some binders. We focused on a healthy bedtime routine. She added in, I think, magnesium and raspberry leaf tea and, all the gut stuff that we were doing. Breathing, that was a big one for her. Her nervous system was a little bit crazy. Her sleep got better. She was sleeping through the night, which she was always waking up between 2 and 4 every morning. Or each night when she was sleeping. So she was sleeping through the night now. Her stress levels were better. She wasn't gassy and bloated. She wasn't constipated anymore. And her bleeding went down after. And my favorite is that we tested her progesterone levels in the beginning of working together, and they were around 9. Then 5 months later, we retested them to see, okay, where are things at? Because things are improving. They went all the way up to 19, which is amazing, amazing, amazing progress in just a few months. She didn't add any exogenous hormones, didn't do anything crazy other than focusing on her gut, her sleep, her breathing, adding in some supplements to help with that dysbiosis, some raspberry leaf tea. She did castor oil packs. So we did a few different things, but I mean, she did it all on her own. She did it all naturally, got her progesterone levels up, her bleeding was down, and her pain. She finally got the diagnosis of endometriosis, and she was able to have surgery and felt so much better. So
that's amazing. Yeah. You've mentioned sleep several times, and it was part of this lady's story too. So what is kind of the connection there? Because I think that might be one thing that people just don't connect. Like, oh, I'm having period problems. Maybe it's my sleep. Like,
yeah, especially with fatigue, with mood swings, with like PMS, PMDD, irritability, that kind of stuff. Sleep is going to be huge. And that comes down to cortisol regulation. What are you doing when you wake up in the morning? Are you grabbing your phone right away? Or are you laying in bed for another hour and not letting your cortisol come up in the morning? Are you going outside, getting some movement in, starting your day with protein, waiting to drink coffee before you have food? Or until you have food. Like all of those are going to be really helpful for morning stuff. Are you waking up at the same time every day? So your cortisol knows when to rise, because if every single day you're waking up at a different time, your body has no idea when you're going to rise. It has no idea that it's a Tuesday and you sleep in on that day. It has no idea that Saturday is your, sleep till 10 day. It's not going to adjust itself. Like you're going to feel tired every time you wake up if every day you're waking up at a different time. So consistency in your schedule is huge. Winding down before you go to bed, all of that is going to be really important, because we're in bed for 6 to 8 hours every single night. Like, why would you waste that time in not getting the recovery, not getting the restoration that your body does when it's sleeping?
Yeah, the detox, right?
Right, like everything that it's doing, you're missing out on all of this that it's doing, and like you're already in bed. Give yourself, like, set yourself up so that you're actually getting that recovery, getting that deep sleep, getting all of those neurotransmitters turning over so you could wake up, feel good in the morning, and go about your day with lots of energy and feeling in a good mood, instead of feeling like, when can I hit the bed? When can I sit down? When can I take a nap?
Yeah, I love all the specific things that you mentioned, because that is very common. Like the scrolling on your phone late at night, scrolling on your phone first thing in the morning, like not having like set bedtime and wake time, like not eating breakfast, like going straight for coffee. All of those things are like red flags. And I'm so glad that you listed all those. Yeah. Okay, so if somebody wants to work with you or learn more from you, what's the best way they can do that?
Yeah, so I have a ton of resources on Instagram, on TikTok, lots of videos. We've got webinars, we've got guides, we've got classes and courses, and you can work with us one-on-one. So there's a lot of different options to how we can, give you the information, the education, and the support that you're looking for. So most people opt to work one-on-one just because we get labs done. We meet one-on-one. You get a lot of coaching, a lot of support, a lot of guidance, a lot of messages, a lot of resources in that way. But not everyone has that flexibility, has that budget, and so we also offer a lot of other ways to get that education and support.
And do you work with people virtually or in person?
Yep, both.
Okay. All right. Good to know. I'll make sure I put all of your info in the show notes. And at the very least, everyone listening should at least go follow you on Instagram, because not only are you educational, but you are hilarious.
I appreciate that.
I love your stuff.
Thank you. Thank you.
Yeah. Thanks for your time with us. This was super great. So much good information here that I know is going to help women. So thank you for your time and sharing your wisdom with us.
Of course. Thanks for having me.
Thanks for listening to today's episode on the Daily Wellness Podcast. We hope that you found it helpful for your own wellness journey. And if so, we'd love for you to leave a review. Then come back and listen for review shoutouts on upcoming episodes. For more information, check out the show notes and connect with us on our website, dailywellnesscommunity.com.